guys hear me okay?
Yep.
We're good. All
yeah.
right. All right, everyone, good morning and welcome to the One ODOT Planning for a Pandemic breakout session. We're happy to have you here. I'm Bonnie Poole. I'm a tort claim analyst in the Maintenance and Operations branch. For some housekeeping items, please keep your microphone on mute when not speaking. The big thing is we are recording this session and we'll be posting it to the Fall Forum SharePoint page next week. If you're having technical difficulties, please message the host directly using the chat feature. We'll be using Slido to submit questions to the presenters. Our hashtag for this session is right there. You can see Planning for Pandemic. Please submit your questions there. We're going to be holding questions until the end, and any questions we don't get to, the presenters will review and submit some responses with the video of this presentation next week. Our Slido information and the full bios of our presenters can be found in the chat function of Zoom. Our presenters today are Ted Miller, Region 1's Maintenance Manager, John Price, Region 1 Safety Manager, Josiah Roldan from the Office of Employee Safety. With no further ado, I'm going to hand it over to Josiah for a presentation.
Bonnie, thank you very much, and thank you all for your time and joining us today. Make sure I can move my slide here. So today's title is Planning for a Pandemic, and at least for my part, I said, how do we protect the health and safety of our employees during a COVID-19 pandemic? So, but before I get to my presentation, I want to give you a little story. So back in July 2019, one of the requirements for the military that I'm part with the National Guard is, as part of their military education, is I had to come up with a research study on potential national security topics or concerns that as a public health officer, I need to be aware of, or letting peoples in higher ups be aware of those national security threats. And I wrote about a pandemic, believe it or not. So did a lot of research, wrote a pretty big, significant research paper on what kind of what we call government soft and hard powers we would do to, one, prevent a pandemic from happening. And that topic was specifically about a novel influenza. It wasn't coronavirus. And I talked about how, well, we were going to have to send CDC scientists over there to help out because it's probably going to originate somewhere in Southeast Asia and so forth. So fast forward to February, March, all of a sudden I'm like, oh my gosh, this is really happening, but it's not a novel influenza, but it's a novel coronavirus. And I really thought I was going to get some kind of a phone call from the FBI or something like, hey, did you have any part in this? Or, or do you have any idea what's going on here? So, when COVID-19 started happening, it really just, it just made everything very real for me. I'm being in the public health field for over 20 years. And I share that story with you because, our title says Planning for a Pandemic. I think there's very few agencies out there, with the exception of the CDC and healthcare agencies, that actually do some planning for a pandemic. For state agencies that are not healthcare, I don't think myself or ODOT or any other non-healthcare agencies would have been planning for it. It's not one of their top 10 emergency preparedness things that they need to prepare the agency for. So really, I think it's about how do we respond to a pandemic as opposed to planning. So with that, it's really how did we respond when we have a pandemic that is a novel virus, and how to make sure that our workplace is safe so that we can continue ODOT's mission. Real quick outline, we'll talk about a little bit about regulatory agencies and standards. We'll talk about the various documents that we had to create as the pandemic unfolded and as new guidance came out. Talk about how what's known as the science of risk mitigation. How did we apply this science to make sure that we're doing what we can to prevent a disease outbreak in our agency? And then also talk about the upcoming Oregon temporary standard, which is going to be a big deal, and it's going to impact the agency, all its state agencies as a whole. And then I think at the end, like I said, we'll have Q&A that we'll save for the end of the presentation. So first, I think it was very confusing to many people when, you know, exactly who are we relying on to provide us with the correct and accurate information and what to do because it's such a new virus, right? So I just want to show you the different players there are that we rely on. There's the Centers for Disease Control and Prevention, the Oregon Governor's Executive Orders, OHA, Oregon OSHA, and then we also have DAS. And one of the challenges here is that you'll hear the governor go on TV, talk about a new standard, how they're going to protect workers. And when people see that or hear that, all of a sudden they think, okay, that's what we need to be doing at the agency, which in some cases it's not. We have to rely as a state agency on DAS to be able to interpret that executive order and then apply that to our agency, right? So people would be confused, like, well, why are we doing this under ODOT, but this is what the governor said? So for us, there's always this lag of when the executive order is announced, and then we have to wait a few days for DAS to update their standards, and then that's how we implement ours or go by. But there's also inconsistencies between these agencies. For example, the CDC does not recognize face shield by itself as being a good protective measure. Their recommendation is that if you're wearing a face shield, you should be wearing a face covering also, or a face mask. Oregon Health Authority doesn't do that. They recognize that face shield, face covering, and mask are all the same, provides the same level of a level of protection. So one of the challenges with our office is that, okay, well, you know, DAS came out with theirs. How do we put the federal regulations, OHA, and then Oregon OSHA, who sort of stands on their own, how do we put that all together to be compliant with all of them and ultimately protect our folks? So that's pretty challenging in itself. And as you guys know, it's always changing. I think there was a period in June and July where every week it was changing. So I think people got, frankly, pretty tired of it, including myself, of all these changes on this different standards that were coming out. And we're not done yet. So we expect these changes to continue to happen. So we need to be prepared as an organization to respond to that. The guidance documents that we've created, and this is not certainly all of it, there's more. There's the facility reintegration guidance that facilities, the Office of Employee Safety, and others had a role in. You have the COVID-19 advisory, which was created by the Office of Employee Safety along with the Safety Resource Team. You have the facts, the frequently asked questions on the mask, face covering, and face shield that the Office of Employee Safety created. Then also how to wear and care for that. One of the things that Oregon OSHA is very strict on is that if you're gonna provide these things to your employees, there has to be a training or some kind of communication on how to care for them, right? You can't just wear a disposable face, a face shield or a disposable face covering for many weeks. You can't do that. So we had to create that document to help people understand on how to care for them. And then more for management, and this involves HR and certainly other division leadership, is management checklist for positive or presumptive cases in the workplace. And that's important because that was a common question that was coming up is we're getting reports of employees potentially being exposed. What do we do about it, right? So this checklist came in very handy as the pandemic progressed and we were starting to see it impact some of our operations. And it was a collaborative effort. And I think there were many times where I was, a lot of these documents as we're creating them, we had to get the okay from key areas like HR, our labor management groups, and others, right? Because this impacted the entire agencies. So we want to make sure it was consistent across the board and everyone had to buy in on it. And in terms of the science of risk mitigation, when we have OSHA complaints, we try to communicate in a way that in terms of they understand what we're doing in terms of risk mitigation. And this is developed by NIOSH, the National Institute of Occupational Safety and Health. So I just want to go over some of the things we were doing using this science as a base for our actions. So the first one is you can't eliminate the product. You can't eliminate the virus. It's out there, right? So that's not even an option. Of course, substitution is not an option. Really, it's those top three bottom ones that we focused on. You have engineering controls and environmental controls. Now, engineering controls is really how do you change the environment around the worker so that it's reducing or mitigating the risk of exposure to COVID-19. So we've done that. We've installed shields and barriers. We increased the heights of some cubicles. So that way, if there's 2 cubicles back to back that, they can't just talk directly into the person, you have some kind of a barrier there. We also increased our cleaning and disinfection of high touch areas. This is something that a lot of facilities have that's happening. And then also we installed additional hand sanitizers throughout buildings, right? So those are what's known as engineering and environmental controls. Then the administrative controls is what are we doing now in terms of policy to limit the risk? So certainly we let people work from home that can telework or telecommute. We decreased the occupancy in meeting rooms, and also with people working from home, that decreased the number of people in the building itself. So that means less people being able to congregate. And then if you have a presumptive case or an actual case, and certainly isolation and quarantine is an option. Just quick, a little bit of what's the difference between the two. I get that question a lot. So quarantine is when an individual have been exposed to someone that is a positive case, but they themselves have not developed any of the signs and symptoms. Essentially, you're going to take that person away from the general population and see if they develop the disease or not. Isolation means you have the disease. You have the signs and symptoms. We're going to put you and isolate you so you don't infect others. So that's the main difference between those two. Then the last one is important is certainly personal protective equipment. This is where the mask, face coverings, and face shields and gloves all play a role in. Now, what is the most effective? It certainly is engineering controls, and PPE being the least effective because there's a factor of if the employer is going to use their personal protective equipment appropriately or correctly, right? So if you see people with a face covering and they have it below their nose, right, that's not going to be very effective. So that is what's known as the science of risk mitigation and hierarchy of controls. And like I said, we apply that on any time we have some kind of a risk and using this scientific method to protect folks. And the last part I want to talk about is, so Oregon OSHA has a temporary standard specifically for COVID-19. And when the first version of this temporary standard came out in mid-August, we responded from the Office of Employee Safety, our comments, our official comments, and put on there some concerning things. For example, if you're going to be in a vehicle, you have to have at least 3 feet separation between, people. We said, well, we can't meet that for some of our vehicles that we have. And so they took a lot of our comments into consideration, and they revised it very recently in mid-September. And they now changed, it's significantly different. So if anyone's want to read that, it's certainly available online. But they basically changed majority of the items in the new temporary standard. And I want to go over what those things are, because this is going to impact like our all state agencies plus any companies out there. So, and the check marks on the left indicates that we're already doing this to some level. So the first one is ensure that a 6-foot physical distancing between all individuals is implemented. So 6-foot distance is sort of that marker for prevent disease transmission. But if you can't meet that, everyone has to wear a mask, face shield, or face covering. The two below, the indoor work setting, is certainly something new. And for example, in any room where the available area is less than 35 square feet per individual, the employer must ensure that all individuals are wearing a mask, face shield, and face covering. So, and then the next one, which sort of goes hand in hand together, whenever an employee is working with at least one other individual in an indoor room that is smaller than 200 square feet, all affected individuals must wear a mask, face shield, or face covering. So what that's going to require us is to start looking, for example, in these meeting rooms and conference rooms and say, okay, you know, what does this mean? Which one is going to be smaller than 200 square feet and so forth. So there's going to be a lot of work in making sure that we meet this temporary standard. The other one, when employees are transported in a motor vehicle for work purpose, they need to be wearing a mask, face shield, and face covering. So we're currently doing that, so we're pretty compliant with that. Employers must designate a distancing officer per staff. We do have that, so that's one thing that we've already done from the very get-go. The big one that we need to implement is what's known as the exposure risk assessment. This is going to be a pretty comprehensive report that uses that science of risk mitigation. And the intent of that document is to say, what are you doing as an agency to protect and prevent the transmission of COVID-19 and protect workers? So the Office of Employee Safety will be leading that, that document. Employees must be provided information and training on regulations. So we're doing this to some degree in different divisions. As the standards came out, as we created the documents, they've had a lot of staff meetings to talk about them and what do they mean. We just got to make this more official to make sure that the training that we're providing is also covering these new standards by Oregon OSHA. And the last one here is the employer must establish a process to notify affected employees that they have work-related contact with an individual who was tested for COVID. So we have that in place, and HR does a great job on their process when someone is presumed or positive for COVID-19. So those are the new standards that's going to come into effect in 1st of November. So we got a little bit of work ahead of us to get this done and be compliant. So for closing, for me, I think what's important for all of us to know is the pandemic is not over. We're still in the midst of this. Just today, as of yesterday, looking at the statistics, we have 7.5 million people that have with positive tests throughout the U.S. with 207 deaths. I mean, Oregon itself, we've had 35,634 cases with 583 deaths. And about 4.7% of every test comes back positive, right? So it is still out there. We need to be vigilant, and we need to continue wearing the mask, face shield, or face covering to prevent other people from getting the disease and also to protect you and your family. And also a new, the weekly report that comes from Oregon Health Authority, they have, as of now, they have 72 active workplace COVID-19 outbreaks. And of those, I think 5 or 6 is state agencies. So we need to be aware of that. We need to be vigilant, like I said, and protect our folks. And the end of the pandemic is unknown. Really the way this is going to end is going to be if there's a vaccine that is both effective, in curing this. And that's a whole problem in itself. On average, it takes 10 years for a vaccine or something to, to be approved for use in the general public, and they're trying to do it within less than a year. So that poses challenges in itself. And then, like I said, implementing the Oregon OSHA is going to require a lot of work across the agency, and just also be aware that regulations will change, and that means we as an organization need to be able to react and adopt, and as soon as possible, so that not only are we compliant, but also we're making sure our employees are safe. And that is my portion. Thank you very much.
All right, thank you, Josiah. Ted Miller, Maintenance Operations in Region 1. I also have John Price from Region 1, our Region 1 Safety Manager. Thank you, Josiah. There may be a little bit of rerun in this, but this portion is just really about how we initially responded. And I remember when this thing first started, it was a lot lot of confusion, at least on, hey, what do you need to do? How do we respond? But we did end up responding fairly quickly overall statewide as a team. And I think the first thing I really want to do is just thank all the business lines that are part of the process for the response. It's all the employees who are making this a success, if you can have success in COVID with low infection rates, and it plays a huge factor in the response, and it shows that the dedication of all of our employees and the people that were a part of this response, that we're doing a great job. It does look like we're in this for the long haul, so just really want to make sure that everybody stays safe and vigilant as we progress through 2020. 2020 has been very challenging. Next slide, please.
Thanks, Ed. I'm John Price. I'm the Region 1 Safety Manager. So what we're going to kind of do with this is flash back and go over how we started handling this in Region 1. Personally, I started tracking this the whole COVID-19 story about November of 2019, and I was just following it personally. And as things started to snowball with it, I kind of got a little more concerned. And then when we got into January, and the end of January, with the first cases reported in the US, boy, I started thinking about, well, what are we going to do when we get to the point where we have cases in Oregon? And then over the weekend of February 28th, March 1st, we found out that we had our first cases in Oregon of COVID-19, and those were in Washington County, right in Region 1. And I thought, oh man, what are we going to do? And I spent kind of a sleepless weekend trying to figure out how are we going to hit this. When I got into the office Monday morning, Ted and I sat down, and that was March 2nd, and we started talking about what are we going to do? What do we need to look at? And so the first thing that we did was we pulled out Annex O from our big emergency binder, and we found that it really didn't fit where we were. We were already past these trigger points of the document, and those trigger points were based on what the World Health Organization classed their alert phases we were already at phase 5, and we found that Annex O really, that we were really behind when it came to it. So when we were trying to develop this plan, this response plan, we looked at what we were going to need and how we're going to approach that. And in talking with Christina Leclerc and Office of Employee Safety, we decided that Annex O was what we were going to go with because it was the best fit for what we had. But we still needed to tailor what we were going to do. Next slide, please.
Awesome, thanks, John. One of the big things that we did right up front is maintenance operations branch and the regions came together to create a COVID-19 response plan. The initial response plan in time would be developed into several documents you can find on the ODOT website. One thing that we started thinking is what is familiar to us for response, and we really kind of gravitated towards, or at least I did gravitate towards, what do we have in place when we have a strike, which fortunately we have not had for a long time, but it actually had a lot of the body and boilerplate in it of what do you do when you have employees missing or employees that are not going or can't do their job. And so we really kind of started that process from there. We worked with Region 2 and their emergency manager as well, and their RMOM to come up with some information that helped us pull together the initial response plan. Talked about how we got our work done, resourcing, structured response. We needed to make a lot of assumptions at the beginning of this based on what we currently knew from CDC guidance and Oregon Health Authority. So we really did try to develop a plan that included all the business lines with the information we knew at the time about COVID. But even though with all the varied information, we just really knew a plan was needed. Next slide, please. And so basically we went through and just tried to bullet out at least most of the high points that we saw. This is probably not all of them, but hey, what do we do with admin? We've got a bunch of buildings that over time we saw started dwindling down in population. I work in the Garrett building in downtown Portland. I would say there are times there might be 4 or 5 people in there now, which you have usually a packed full building with lots of visitors. How do we get around answering the phone? How do we do payroll, vendor contract payments, computer support, human resources? We also worked on developing a list of employees. It was very important to make sure that we had a good, accurate list of employees so we could go through and track everybody, which eventually turned into how do we track folks that may have contracted COVID or had symptoms, so we could make sure that we were giving them the proper support that we could. We really needed to start thinking about communications, internal communications, external communications, with the public and the stakeholders through our PIOs, Emergency Operations Center, the AOC. How do we communicate amongst ourselves? In Region 1, we did stand up our EOC for this. And they stood up for several other things that happened recently as well. Amongst COVID, we had protests and fires and a large trending project. So it really taxed our Emergency Operations Center, but gave us a lot of good experience at the same time. We also needed to make sure we were communicating to our local city and county folks. How do we make sure that we get that done? Maintenance operations, definitely. I talked about the Garrett building, a lot of people working from home and being able to do that as we worked through all of the issues with computers. And our IS folks really digging in and making it a whole lot easier for us to work from home. We had a lot of employees out there that had to respond to emergencies, the hazmat, fires, serious and fatal accidents, spilled loads, drainage issues, structural damage. We have had structural damage since then. So we've got signals, we've got ITS, we've got all kinds of traffic operations that still needed to be done and still had to have people in place to get that work done. So we had to really try to figure out how are they going to get their work done in COVID, do it safely, but try to remain following CDC and OSHA guidelines. We have obviously bridge list operations. And at that time we said, hey, winter operations is applicable, but now we know we're going to have to do this through winter operations. And so we're also working on that. At that time, we thought, well, maybe this thing will pass like the flu, but guess what? We're going to be heavy into it. We also, we really wanted to make sure that we had our non-emergency response and operations type stuff covered as well. Communications with ODOT and other agencies across our borders. Making sure that we can still respond to customer complaints and things like that. We've got policy development, project delivery, and tech support. In maintenance, we have a lot of project delivery support, not only in our projects, but actually out in the field with response to hazardous materials, slides, washouts, BMS, ITS type stuff, construction and tech center. Support that we give in maintenance operations back the other way. Safety, obviously a big one, accident tracking, accident investigation, all of our workers' comp, and development of safety items to change and and how we do our work in COVID. Next slide, please. I think you're muted, John. Not muted. Muted.
Woohoo! I'm unmuted now. Yay! I win. All right. So one of the things that was a big challenge, I think, for everybody, us included, was that we had rapidly changing information that was coming in with regard to the COVID virus and recommendations from CDC, information on a world scale coming in from WHO, changes in information coming out from OHA, new information from the governor, and then also from DAS. And so we were all inundated with all of this information that we had to consider while we were planning for how we were going to continue business, that business continuity aspect. And it was a real challenge, and we had to shift gears. And I know that for a lot of people out there, it was really frustrating because we'd have direction that came out one day, and then the next day we had to shift and say, okay, sorry folks, we got to change. And that was par for the course. And we ended up having to experience that over and over again. And we really tried not to cry wolf over and over, but to let people know, hey, this is the newest information we have. This is the latest direction that we have. But a big component of that was trying to make sure that we were doing the best we could to not only to maintain that business continuity, but also to look out for all of our folks and do the best we could to take care of our ODOT family. So when we were looking at that plan and looking at building a new document based on a variety of resources, one of those was looking at Annex O and some of the components of that, encouraging employees to stay home when they're sick. It was one of the first things that we did, was post that, get that information out to managers, encouraging their folks that if they show signs of illness, that they should stay home. And then also to try and stop that unessential travel, one crew going over to another to visit, or to encourage any other practices that would really minimize that face-to-face contact between employees, either teleconferences. I know that we all used the heck out of Skype. We went crazy on Skype, and I think we crashed Skype as an agency a couple of times. We've all experienced a variety of video conferencing platforms now by this point in time. So we were really trying to encourage those flexible arrangements. And that's when we really started looking at telecommuting. And this was a real big push because it was a change for our agency. It was a big change for our agency to go to a vast number of people telecommuting. And it was a challenge. When Ted spoke to the Garrett building, having 5 or 10 people, that's going from several hundred people in one building down to 5 to 10 people, maybe two. It was a big change in the way that we did business, but I think that we were very successful, not only as a region, but also as an agency, that we were able to maintain that business continuity. When we went, going forward, we had to look at those people that were going to be there in person. How do we help them understand what they needed to do as far as the sanitization and personal hygiene, encouraging people, hey, try not to touch your mouth and nose. Wearing masks helps you not touch your nose and mouth. Hand sanitizers. Which hand sanitizers do we use? How do we clean surfaces? Changing practices and contracts for frequent surface areas that are high traffic areas being cleaned by contract custodial companies. Changing those contracts, making sure that we were covered. But then also trying to provide those resources for our employees so that they were able to take knowledge that we provided them at work, apply it at work, but then also to help them with their home life and their family life, to have those tools and knowledge to be able to work through that at home. there were a lot of things that really did work in Annex O. And so including those in our agency plan and our region plan really helped a lot. But making sure that we did provide as much up-to-date information, education, training, and resources as we could, and getting to those points of installing those barriers, getting to the point of trying to make sure that we had PPE for everybody that was going to be continuing to come into the workplace, and that there were regular cleaning schedules so that we could not only take care of our facilities to keep them safe for people, but also help keep each other safe by way of using facial coverings and everything else, and maintaining the distancing. So that progress, the progression of those events, and the progression of information that came out really played into an evolution of the response, not only for us in Region 1, but also as a state agency. That evolution is still happening. And as Josiah spoke earlier, it's continuing as we start to see some new, some regulatory standards coming out of Oregon OSHA with regard to a lot of those elements and how we work with this COVID-19 virus and how we respond to it as an agency. The big win for us is that, as it turns out, many of the things that we had incorporated into our plan early on, and as our plan as an agency evolved, many of those things really set us up for success with the OSHA standard that we've got to deal with now. Next slide, please. Some of the resources that we had to rely on heavily were our region safety managers and the safety managers from Oregon, from Salem, our Office of Employee Safety folks. We all worked together as a team and really did do a lot of research individually and then collectively to try and come up with the best messaging and the best information we had. That really made a big difference. But then also our partners in the storeroom in trying to get those resources in, whether it was cleaning supplies or whether it was personal protection, PPE, hand sanitizer, all that stuff. It was a real challenge because we also had to consider how all of those elements were going to be billed and tracked and everything else. Those task teams that we have, the emergency procurement task team, reintegration planning, the maintenance operations branch that worked on the best practices, all of those task teams, absolutely invaluable. There's no way that we would have made it where we did and how far and come as far as we have without all those people working together. It was a real cohesive effort, and we really did work together as an agency. But it was rapidly changing. As everybody I'm sure can remember, we just had, the situation was evolving, information associated with all of that was rapidly changing. And the more we knew about the virus and the more the information that we had, those directions changed from health authorities, and we had to adjust our response. That we were able to do so, it speaks volumes to how we all came together as an agency team, working from different angles on that. Next slide, please. As Josiah spoke to earlier, there were a lot of external partners that we had. Christina Leclerc and our agency executives were interfacing regularly with Oregon Health Authority and also with Oregon Emergency Management. Information coming in through them from CDC and the World Health Organization. Those resources were very, very valuable in determining our response and adjusting our response as we kept going. And so it was really, really a concentrated effort on everybody's part. And so in no small way, all of the thanks is due to everybody as a whole. I think that's our last slide. Is that right?
Yes, it is. And that concludes our presentation, and I'll turn it over to you, Bonnie.
So there are two questions. The first question we've received is, what lessons learned from COVID-19 can you apply to other widespread emergencies like Cascadia? Have you found some previous assumptions to be incorrect?
That's a good
Whoever wants to
question.
jump in.
Yeah.
Oh, Ted, you're muted.
Thanks for reminding me, John. There's always something to be learned from every, talking about the emergency response side. So every time we stand up for an emergency response, it's a new emergency. We learn more about emergency response and how we act as a transportation agency. So I'd say one of the factors, and I'm sure John or Josiah may have more, but it really does help us hone our skills as far as emergency response is concerned and how we move forward.
One of the things I think that Ted and I said frequently to each other was, was something along the lines of, don't assume anything. Don't make any assumptions, because just when you assume that something's going to stay the same, it changes. And that ends up being the case in emergency response when you're dealing with emergency operations centers and any emergency response on a larger scale. That's just, it ends up being the case. You can't take anything for granted, whether it's resources or information. It's, you just, and so keeping that in mind, I think that that we were able to make those adjustments without any hangups. I think that it's really important. One of the big takeaways, I think, is that making sure that there are no egos involved, because looking out for people and an agency and the whole of ODOT was the most important thing, not, who's getting credit for what.
And I think for me, I joined ODOT in mid-May sometime. And prior to that, I was at Oregon State Hospital, and we activated our EOC back in November. And I was the incident commander for preventing COVID from getting in our hospital. And to me, the learning lesson here for me and the opportunity is good communication is going to be key, because especially when it comes to virus or just disease outbreaks, it's about education and information is key. And having a good communication plan to inform 4,700 people, it needs to be one of those top priorities in any emergencies. Communication is always the first one to go. And that's why it's critical that as an organization, we have that good communication, different ways of communication, employees to get the right information at the right time to the right people.
Thank you. Our last and next question is, what is ODOT doing to ensure consistency in processes, permissions across the agency in regards to teleworking? Example, allowing digital signatures or not?
Yeah, I think the modern work environment task group is really playing a key role in that. I'm part of that group, and we're really looking at how do we make sure that we have consistency across the agency, right? So I know that's one thing we're doing is we're meeting almost weekly on one to prepare our agency for almost 1,500 folks to work permanently or in some capacity at home. And we're covering every possible scenario or issues or concerns or problems and problem solving through that. And communication, again, is going to be a big part of that, and making sure the agency is consistent across the board.
Well, that is it for questions. I want to thank you guys for presenting and taking your time to educate us. If there's nothing else, I think we're done.
Thank you for having us.
Thank you.
Thank you, Bonnie.
You're
Thank you,
welcome. Bye.
Thanks, Bonnie.